Hello everyone, welcome back to channel for doctors, and today we are going to continue our session on the hand anatomy of the musculoskeletal system in reference to the book that is First Aid USMLE Step 1. So the about the hand muscles, we know that the hand muscles are divided into two groups. One of them is known as the thenar eminence that is present on the thumb side, and then we have the hypothenar eminence that is present on the little finger side. So about the thenar eminence, the thenar muscle group is supplied by the median nerve, while the hypothenar group is supplied by the ulnar nerve. About the thenar group muscles and the median nerve, it supplies the opponent's pollicis, the abductor pollicis brevis, and the flexor pollicis brevis, the superficial hair. The deep hair is supplied by the ulnar nerve. So we have three types of muscles that are present in the thenar group that are supplied by the median nerve, and here is a mnemonic that is provided by the first aid that you can use to remember the groups of muscles. One of them is the oppose, abduct, and flex. So oppose stands for opponent's pollicis, the abduct stands for abductor pollicis brevis, and flex stands for flexor pollicis brevis. These three muscles are supplied by the median nerve. Then we have the hypothenar group. Hypothenar group is a group that is present on the small finger side, and it is supplied by the ulnar nerve. It includes muscles such as opponent's digiti minimi, abductor digiti minimi, and flexor digiti minimi. So pollicis stands for thumb, and the minimi digiti minimi stands for the little finger. So that way you can also remember which group of muscles include which side is either the hypothenar or the thenar. So the pollicis stands on the thenar side, and the digiti minimi stands on the hypothenar side. Then you have the dorsal interossei. Dorsal interossei are basically a group of muscles represent on the dorsal side of the metacarpal regions, and these are supplied by the ulnar nerve, and the function of them is to abduct the fingers. And then we have the palmar interossei that are present on the palm side. They are also supplied by ulnar nerve, but their function is to abduct the fingers. So the dorsal interossei abduct and the palmar interossei adduct. Then you have the lumbricals. Lumbricals are basically group of muscles that are present between the fingers. So the first and second lumbricals that is present between the first and second finger, these are supplied by the median nerve, and then you have the third and fourth lumbricals that are present on the third and fourth fingers, and these are supplied by the ulnar nerve. The function of lumbricals is to flex at the metacarpophalangeal joint and extend at the proximal interphalangeal and distal interphalangeal joints. Then you have the distortion of the hand. Distortion of the hand is basically any defect in the any defect or deviation from the normal use of muscle groups. So at rest, a balance exists between the extensor flexors and the extensors of the hand, as well as the intrinsic muscles of the hand, particularly the lumbricals muscles such as flexion of the MCP and extension of the dip and pip joints. However, there is a deficit that is known as the clawing of the hand that is seen best with the distal lesions of the median or ulnar nerves. So in this condition, the remaining extrinsic flexors of the digits exaggerate the loss of the lumbricals. The fingers extend at MCP, flex at distal interphalangeal and proximal interphalangeal joints. The deficits are less pronounced in proximal lesions. However, deficits present during the voluntary flexion of the digits. So we have a few signs to remember the involvement of different types of nerves and different types of muscles. So the ulnar claw is seen with the defect in the ulnar nerve, and specifically the distal ulnar nerve, and there is a defect at the extending the fingers at rest. Then we have the hand of benediction. So the hand of benediction is more pronounced while making a fist, and it is due to that is more pronounced during making a fist, and it is due to involvement of the proximal median nerve. Alright, and then we have the median claw. Median claw is due to is more pronounced during extending fingers. It can also be present at rest, and it is due to involvement of the distal median nerve. And then you have the OK gesture, that is the person cannot make a OK sign or while making a fist, and it is also seen in the lesions of the proximal ulnar nerve. So we have four types of defects. All right, two of them are the proximal ulnar and proximal median, and then we have the two lesions that involve the distal ulnar and distal median. So For the ulnar nerve, when there is distal ulnar nerve involvement, we have the ulnar flow. When there is proximal ulnar nerve, we have the oca-adductor defect. For the median nerve, when we have proximal median deficit, we have the hand of benediction, and when there is distal median nerve, we have the defect that is known as the median flow. You need to memorize it well because the USMLE exam is quite tricky and it is quite conscious while asking about these type of defects, and they want their students to be well versed with these defects and what's the function of different types of nerves. These can be tested on the USMLE exam, so you need to be well aware of this. So this was all about the today's topic about the muscles of the hand and their blood supply, nerve supply, and their function. And if you have any questions, you can ask in the comment boxes. We will we are going to study about the next topic such as action of hip muscles and different types of muscles of the lower limb in our next videos. And this was all about for today. Thank you.